What do you do when your child gets a stomach bug? So they're vomiting, having diarrhea, maybe having some belly pain. What fluids do you start with? What food do you give and what do you avoid? What medications do you offer and which ones should you not? I'm Dr. Nkirika, pediatrician and pediatric emergency medicine doctor. And in this video, we're going to talk about stomach bugs, vomiting, diarrhea, how you can manage the initial symptoms at home, when to go to your regular physician, even the ER. Gastroenteritis, which a lot of us know as a stomach bug, is one of the most common causes of vomiting and diarrhea in kids. It simply means the irritation or maybe inflammation of the feeding system, the lining of the stomach, and the intestine. It can be caused by viruses commonly, but also can be caused by bacteria and even parasites. Viruses are the most common cause of stomach bug, and there's so many names. There's a norovirus, enterovirus, rotavirus, and a whole lot more. And they're usually contacted by getting exposed to either the vomit or the stool of someone who's already been infected. It can also be contacted if you touch surfaces which someone else who's been infected already touched. And because these bugs usually stick on surface for a long time, they are more prone to spreading that way. Daycare workers can also spread this infection, especially when they change diapers or use the bathroom without following a proper hand hygiene and touches the next child. They are more likely to spread to that way. Bacterial stomach bugs, on the other hand, can be contacted by ingesting, which is eating food or water that's been exposed to the bacteria, especially food that's been sitting out for a long time. They're not as common as viruses, but they also tend to make kids sicker. And we're going to talk about red flags for you to watch out for that makes it more likely to be bacteria versus viral stomach bug. So while there are different types of organisms that cause stomach bugs, the initial symptoms and initial management of all of them are just about the same. For the purpose of this video, we're going to focus more on the viruses, but we're going to talk a lot about the symptoms and how you can manage this at home. So what are the common symptoms? Children may have diarrhea, vomiting, nausea, belly pain, fevers, refusal to eat. Some may have headache and joint pains. When it starts progressing, some kids may start to show signs of dehydration. So what do you do when your child has a stomach bug? First of all, when your child has a stomach bug, it is stressful and it is overwhelming. I like to categorize management into 4 different categories to make it easier to remember: hydration, feeding, medication and other home remedies, and diaper care or butt care. And let's take it one by one. So number 1 is hydration, and this is the most important one I want you to focus on. Babies and kids are mostly made of water, so they tend to lose water really fast and can get dehydrated. So I want you to focus on hydration. You want to wait 20 to 30 minutes after every vomiting episode before you offer your child any fluids to drink. The reason is, if you offer immediately, babies and kids are more likely to take because they're always eager to keep drinking. But the more they vomit, the more the cycle persists. So you always want to give them 20 to 30 minutes for the intestine to settle down before you offer again. Start with clears, and they should always be their preferred fluids. When they are sick, you always want to give things they prefer and not just necessarily things you want to give. And we're going to talk about preferred fluid next. You want to start small. They're always excited and want to take more, but you always want to start small. 5 to 10 mLs of fluids, depending on the age. If they're a bit older, you might be able to give 10 mLs, but usually you want to start with as small as 5 to 10 mLs. You want to go slow. We always get excited when our babies all of a sudden vomit and then they tolerate 5 to 10 mLs, and we want to give them more. But we want to start and go slow. If we hurry up and give them a lot, then they vomit again and we start the cycle all over again. So 10 mLs every 10 minutes at least for the first hour, and then you gradually increase. If they tolerate it for like another 1 to 2 hours, then you can go to solids and see how much they can tolerate. And then pause and restart if in between your pH, what we call the oral challenge, they vomit. If they vomit, then you have to pause, wait 20 minutes, and start all over again. I'm going to give you a full example so that way it's easier for you to understand. If your child vomits at 6 o'clock, you want to wait till 6:20 or even 6:30 before you can offer fluids. Let's say we're going to offer 10 mLs. You give them 10 mLs at 6:20. You wait for 10 minutes, which is 6:30, before you can offer another 10 mLs. And if they're able to keep it down, you wait for another 10 minutes and gradually increase. If you do that for an hour and they tolerate the 10 mLs, then you can either go to 15 or 20 mLs for the next hour. If they tolerate 20 mLs for the next hour, then you can gradually increase. And by the end of 3 hours, they might be ready for solids. Of course, every baby and child is different, but if they vomit along the way during your oral challenge, you want to pause and restart again. What are the clear preferred fluids you want to start with when you're trying oral challenge for the babies or for the kids? One, if your child is breastfeeding is a great option to start with. If they're formula feeding, that's also a great option. You just want to make sure they're tolerating either the breast or the formula. The other options are Pedialyte, dilute apple juice, dilute Gatorade, or even popsicles for bigger kids. Studies have shown that dilute apple juice is not inferior to Pedialyte, and some kids find this more palatable and they're able to tolerate it. So now we talked about hydration, and thankfully maybe your child is tolerating fluids. We're going to move to feeding. And this is one that a lot of us parents struggle with because we're watching our babies and kids who used to eat a lot before refusing to eat their solids because they're sick. But if you remember, as adults, when we are sick, we rarely want to eat as much as we want to, and that's just about the same thing as kids. Kids can actually stay longer without food as long as they're well hydrated. When it comes to the type of food, what options do you have? So in the past, we would recommend brat diet, which is banana, rice, applesauce, and toast. But we don't do that anymore because one, we've noticed that it's not very nutritious for babies or kids, and some of them don't even like it. Offer them what they prefer, whatever they like to eat, but a few exceptions. You want to avoid foods that are very fatty, which has a lot of fat, fries, pizza, foods that are very acidic, lemon, orange, carbonated drinks, and milk, because this might irritate them more and make them more uncomfortable. The reason is when a child has a stomach virus, or when even adults have stomach viruses, the lining of the intestines are wiped off and the enzymes may not be functioning as normally as they're supposed to, and they're not able to handle the sugar contained in milk and some carbonated drinks. And the more you give them milk or sugary drinks, the more likely they're going to pass a lot of stool and get dehydrated. So the next is medications and home remedies. So what home remedies actually help kids who are nauseous and vomiting and generally help them. So ginger has been found to help with nausea. That's why a lot of people use it for motion sickness. And depending on the age of your child, they might use it as ginger chews. You may grate them or they can even smell them. In some cases, you might be able to drink a few sips of ginger water, but we generally don't recommend this for babies. Alcohol swab also works well. They just have to put it under their nose to smell a little bit. And it's been shown to help suppress the what we call the emetogenic centers in the brain and help decrease nausea and actually decrease the episodes of vomiting. So these are home remedies that might help your child. In terms of medication for vomiting, there's a really great drug called ondansetron, which a lot of us know as Zofran, which helps a lot with vomiting. That's one of the medications we give a lot in the ED. And because we don't like treating diarrhea in kids, we treat the vomiting so that way they're able to keep things down and not get dehydrated. Other medications like acetaminophen for pain will be helpful for babies and kids who have a belly pain. We tend to want to hold off on ibuprofen because if your child's belly is already irritated, ibuprofen is more likely to worsen irritation, but if that's what your regular physician prescribed, you can take it. But when you're concerned about pain, it might be better to give acetaminophen for pain or even fevers than to give ibuprofen. Antibiotics may also be needed in cases of bacterial gastroenteritis. Like I mentioned before, you have virus and bacteria as causes. Bacterial gastroenteritis in some kids might require antibiotics. So two medications that a lot of families jump to, we actually don't recommend in kids are one, Pepto-Bismol, because it contains salicylic acid, which can increase chances of a child having liver disease. Two is loperamide, which a lot of us know over the counter as Imodium, is actually not recommended, especially in kids and babies who are younger than 3, even 4 years of age, because one, it causes a lot of constipation and makes their symptoms worse. So when it comes to diarrhea, as much as we as families want to stop the child from poop because it's stressful, we actually do not treat or stop diarrhea in kids. So how do you know it's a virus versus a bacterial gastroenteritis? Like I mentioned before, a lot of the initial symptoms are about the same thing. We don't necessarily know. But when it comes to the stool, one of the main things to watch out for is blood in the stool. If your child has blood in the stool, it's less likely going to be from viral gastroenteritis. And as a matter of fact, if your child has blood in the stool during a stomach virus or any other time, we recommend them checking in with a regular pediatrician or the emergency doctor because the stool typically needs to be tested. And of course, if it tests positive for a type of bacteria that we like to treat, then your child will get treated. How long does this whole stressful ordeal of vomiting and diarrhea last? So this depends. In some cases, most of them last between 2 to 4 days. But it's not uncommon for some episodes of diarrhea to linger on to 7 to 14 days. Of course, we expect a child to no longer be vomiting, either self-resolved or need medication to help resolve the vomiting. But diarrhea might linger on to about 14 days. But we expect it to be getting better, meaning if your child is going to the bathroom or pooping about 8 times a day, over the time, we expect them to go down to like 5 and 3 and 2 and gradually come back to their usual bowel habits and not just having a lot of lose multiple stools a day. What are some red flags you should be looking at? So the most common one and the most important one I always want you to watch out for is dehydration. Babies lose fluid so fast, and if we're not keeping on top of the hydration, they are more likely to get dehydrated. So you want to watch out for crying without tears, delayed cap refill, sunken soft spot, which is a top on their head, feeling lethargic, decreased urine or decreased wet diapers. Those are signs you want to watch out for. I have a dehydration checklist in the caption, so you want to click on that just to see, based on the ages, how to evaluate and what to do when it comes to dehydration. Other red flags include greenish vomiting because we're concerned about obstruction, blood in the vomit, blood in the stool, like we mentioned before, might be bacteria, but they're usually preferred to be tested. If your child has any gray or white stools, especially if it's associated with also looking yellow in the eyes and yellow in the skin, we get concerned about liver problems and want to see them to an evaluation. If your child has only early morning vomiting, especially with the headache, you want to get them evaluated too. If your child has persistent vomiting, especially if there's no runny stools for like 24 to 48 hours, we get concerned about obstruction and want them to be seen as possible. So what are the possible treatments my child may need in the ER? So one, it depends on what your child looks like on evaluation. If your child is well hydrated but not able to tolerate orally, we might give them ondansetron, which is Zofran, to make sure they're able to keep things down, and we can challenge them, what we call oral challenge, and see if they're able to keep things down. If they're able to keep orally down and look better, we can actually send them home with some doses of the same medication to keep encouraging them at home. On the other hand, if your child looks super sick, unable to tolerate anything by mouth, they may get an IV just to help boost their fluid level and hydrate them with IV fluids. And in some cases, if they don't look better, they may be admitted to the hospital to continued hydration for a certain amount of time until they start to recover. So let's not forget about diaper care. We talked about hydration, feeding, and medication. When babies and kids are having a lot of blowouts and diarrhea, they tend to get raw in the bottom, so you want to stay on top of the diaper care. For K2 and diaper, you want to make sure you're coating your butt with, it might be zinc oxide, it might be diaper cream. I have a whole new video coming out for diaper rashes, so you can click on the notification button so you make sure you know when that video drops. But you want to coat their buttock with diaper rash cream so that way you can create a barrier between their butt and the stool. Of course, in kids that are older, you can also use the same thing. You can use things like Vaseline to make sure you're rubbing their butt so that way it doesn't get too raw and make them super uncomfortable. Finally, how do you prevent your child or other children in the house from getting gastroenteritis or from spreading to the rest of the family? So viral gastroenteritis is very contagious, and that's one of the reasons why it spreads widely. There are multiple steps when it comes to prevention, and it's very stressful, I know, but this is something you have to do when there's an outbreak in the house or when one child starts to have vomiting and diarrhea. The first helpful thing is to have gloves. Gloves protects you from getting exposed directly from the vomit or the diarrhea and always tend to keep you safe. Grab some gloves, wipe up the vomit or the poop with paper towels, and throw them away immediately. You clean your surfaces as often as possible, and you want to clean them with bleach. A bleach makes a bleach cleaning solution which you can buy from the store or you can make use at home. So most of these viruses and bugs don't respond and don't get killed with alcohol and water, so those will not work. To clean the surface, this includes like the doorknobs, the fridges, the stairs, remote controls. Wipe them down as often as you can or as often as possible with bleach cleaners. Wait for about 5 to 10 or 15 minutes for that to seep in, and then you can wipe them again with warm water and clean cloth. I know it's a lot of steps, but this is one of the ways to decrease the likelihood of anyone in your family getting this. When you're done with cleaning, you get rid of your gloves and then wash your hands with warm water or water and soap for at least 20 seconds. This not only protects you, but prevents you from spreading to other surfaces that you just cleaned. So I know this has been a lot and this has been a long video, but here are some takeaways I want you to remember. Stomach bugs are common. Viruses are the most common cause, and kids are more likely to get dehydrated from the vomiting and diarrhea. So I want you to focus on hydration. Babies and kids may not be as much interested in foods as they are of fluids when they're sick, and that's okay as long as you stay on top of hydration. Know the symptoms and signs of dehydration and know when to get your child seen as soon as possible. If your child has any other red flags, the greenish vomit and the blood in the stool, the persistent and cramping abdominal pain, please make sure you get them seen. I hope this has been helpful for you and your little one or your children to be able to get through this if they have vomiting or diarrhea. Leave me a comment in the comment section if you have other questions that I didn't treat, or you have any other concerns or topics you want me to discuss. Leave me a comment in the comment section, and please do take care.